When you hear the words 3D, do you instantly think of the movies? Well, in the medical field, it has an entirely different and exciting meaning. 3D views are giving doctors a whole new way of diagnosing and treating patients. And for the first time in any hospital in our state, radiologists at Riverside Methodist Hospital will soon have 3D images for breast exams. And here to explain the benefits of this new technology is OhioHealth Radiologist Dr. Pat Borgess. Doctor, nice to have you here.
Thank you for having me, Gail.
This is really exciting, and you told me earlier the machines are here. We have them, not quite working yet because there's a lot of training that goes into these.
Correct. There's extensive training for the radiologists on how to interpret the examinations as well as for the technologists on performing those. So we hope to be up and running by midsummer.
What is new about this, and how can you explain it so that we all understand, as women who have breast exams, what this entails?
Okay, this is a mammogram. Two views are taken of the breast, but instead of a conventional mammogram where just a single image is taken in the top to bottom and side to side view,
correct,
the machine moves in an arc over your breast, either across the top or across the side of it.
And we're looking at some video of the machine there, and I can see how it moves like that.
Yes, and that information is sent to a computer, which then makes that into very thin sections through the breast. Depending on breast thickness, you may have 50 images in each projection to look at, or up to 200 images of the woman's breasts. And the radiologist then can go through, and the resolution is very, very exquisite, and help determine whether something is a true mass or whether it's just overlapping breast tissue shadows.
So when would someone use this? Would most of us still do the traditional mammogram for our regular annual exams?
Correct. And the FDA did approve this for screening, so it can be used for screening. We definitely will be using it for diagnostic workups on problem cases, definitely for high-risk women. I think it'll be very beneficial for young women with dense breasts to try to see through that dense tissue better.
This is very exciting for the medical community, but so much so for the patients.
Oh, it is. It is. Anything that we can do to increase the detection of breast cancer at an earlier stage so that those women can be cured, we're just very excited about.
So this machine, before this was here, and you had a mammogram that showed maybe some suspect places, what would happen? What would be the next step, and where does this fit in that step?
Well, we would bring them back, and then we generally take spot compressed views and different images to see whether the tissue spread out or we still thought something was a mass there. If we use it as a diagnostic, the woman would, in all likelihood, just have to be compressed once and have the arced view done, and then we can reevaluate it that way. It does take a longer exposure, so the radiation dose is about double what a conventional mammogram is, and women have to hold their breath for about 12 to 15 seconds longer, which in most people won't be a problem, but for some of the older women it may be an issue.
Can some women ask for this, or do you have to be recommended by your doctor to have this type of test?
A woman could request it.
You could?
Yes.
Depending on possibly if you have a history of breast cancer in your family or something like that?
Correct.
Okay. I always say it's uncomfortable when you have a mammogram. It doesn't hurt, but it's a little bit uncomfortable. Was this process the same way?
It is, and you will be in compression a little bit longer. Again, 12 to 15 seconds per projection longer.
As a doctor and seeing this, are you excited that we will be able to see possibly women that really need to have, if you find breast cancer, they need to start that treatment sooner, because that's really what it's all about, isn't it, doctor?
Absolutely.
Are you going to be trained to see this, or is it a different doctor that actually uses the machine?
No,
into those?
I'll be doing it, and I'm very excited. Yeah, my training will be later this month, actually.
And it's going to take quite a while to do.
Yes.
The only hospital in Ohio.
Absolutely. Yes.
Okay, we're going to show that scan one more time, and this is what you're going to do. You're going to be able to see this breast tissue, as you said, in different layers so that you can see if there's cancer, if there's cyst matter, whatever is in there.
Yes.
Is that correct?
Absolutely, yes.
And when do you see this starting, possibly?
Midsummer.
Okay, wonderful. Well, I want folks to know that we've been working with OhioHealth as far as educating folks about breast cancer, and tonight we have members from the OhioHealth team who will be back in our NBC4 studios from 5 to 6:30 answering the call for lines and questions about breast health. So we hope you tune in tonight and give us a call on the call for phones. And you're going to be on the phones tonight, aren't you,
yes,
doctor, to answer all those questions? So you may get some questions about this new method as well. We hope you do.
I hope so, too.
Thanks,
Thank you,
doctor.
Thanks for having us.
Coming up next, don't